यहाँ पे सारे आ जाएंगे, बच्चों के नेम और रोल नंबर
ठीक है,
सारा आ जाता है। वो भी लॉगिन करना स्टार्ट
ऑनलाइन करके सो जाते हैं मास्टर है
लगाइए इधर से आइए, बैठ के करना पड़ता है।
कौन सा है?
ये आपका इसको
नहीं कॉपी कर लें, क्या कर
ऐसे ही कर लो डायरेक्ट।
नहीं कॉपी कर लेता हूँ।
कॉपी कर लो।
ये जो नीचे वाला है सबसे, कॉपी कर लो।
निकाल लो, निकाल लो। वो दूसरा बन गया। ये है आपका? नहीं नहीं, अभी तक तो लॉगिन किया नहीं किसी ने।
कोई बात नहीं, कर लेना आप। अब लेक्चर का कर दो बस।
हाँ वही कर लो, वही कर लो।
चालू करूँ? कुछ लिखा होगा इससे?
नहीं ये इसका नहीं, ये निकलता रहता है ना, तो वो इसका वो गिर गया।
कोई बात
निकल
नहीं,
तरफ से गिरता
छोड़
रहता है।
छोड़। Good morning. We will start with the Leishmaniasis, which is called it as a visceral Leishmaniasis, also known as Kalajar, black fever, and dum fever. It is a protozoal disease which causes cutaneous ulceration and then leads to a systemic manifestations. Distribution is worldwide except Australia and Antarctica region, but the causative organisms are Leishmaniasis species with 20 different species, but the most prevalent which are available in a country like India is Leishmaniasis donovani, tropica, major, Braziliensis and Mexican. Transmission is the vector is a sand fly. It is a phlebotomous, mainly Leishmaniasis donovani and tropica and major, and sand fly Myxomyia, that is Leishmaniasis braziliensis and Leishmania mexicana. The 90% of cases occur in India, Nepal, Sudan and Brazil, and in India this visceral Leishmaniasis is more common in a state like Bihar, West Bengal, Jharkhand, UP and some part of Odisha. It can be divided into a cutaneous one, mucocutaneous, visceral and viscerotropic. Like this is a cutaneous one, the upper ulceration of the skin. Muco means in a buccal cavity, this one, and visceral, which leads to a systemic manifestation, and viscerotropic, both this and this, cutaneous as well as systemic. These are few examples of like what is developed in a cutaneous ulceration, that is this one, and this is a mucocutaneous, mainly occur in a buccal cavity and upper and lower lips and all that. And this is a systemic manifestation on the abdominal area, rectus area, and these are all on skin parts and all that. And these are basically this type of ulceration which lose out pus and blood, and if you just increase the size, the one patch consists of so many other patches also. This is the worldwide distribution. The life cycle, if you start with this, the phlebomatous, the infection by bite, it goes into a skin, into the man, and the transformation of amastogates, this one, that is the egg formation, and then ingestion by macrophage and some parasites in a peripheral blood, and some of them carried to a deeper organ causes visceral one. Those who are superficial can cause a cutaneous one, like this remain in the skin causing a cutaneous leishmaniasis. So whatever the superficial goes can cause cutaneous one, and those who carried into a deeper organ can cause visceral one. And after 5 days there is transformation to promastigate, and the promastigate infected after fly feed on certain diet, and this cycle goes on. And by infection within a 5 days the symptom will occur in a human being. Pathophysiology, it is a inoculation. The parasite infect the RES, reticuloendothelial system, that is live in intracellular lysosomal organelles or macrophages and incubate for weeks to months. And the skin lesion or as a disseminated systemic infection involve the liver, spleen and bone marrow. So it is a RES system which is a carrier and incubate in our body and then the systemic infection appear either at skin or liver or spleen and bone marrow. The characteristics or clinical manifestation is a fever, weight loss, enlarged spleen and liver, that is organomegaly, abdominal swelling, anemia, dark skin, low WBC and platelet count, and hypergammaglobulinemia. So mainly you can diagnostic point of views, the ultrasound and all that. You can see the enlarged spleen and liver, and subsequently their enzyme level, the dark skin, anemia, and a swelling at an abdominal area. The visceral leishmaniasis is a progressive disease. The mortality rate without treatment is quite high, 75% to 95%, and death usually occur from malnutrition and secondary infection. Tuberculosis, pneumonia, and dysentery are commonly implicated. So those who are already infected with the tuberculosis have a more chance to progress the disease in particular patient. The clinical picture, the diagnosis find the clinical picture significant but not sufficient to confirm infection. The gold standard is a bone marrow or liver biopsy to detect amastogates, that is a brown Hobbs staining. And splenic puncture is more productive one. The lymph node aspiration are less sensitive, like the most people do in a FNAC and all that. The culture of blood biopsy specimen may relieve the parasite, that is a Nicoll-Novy McNeil triple N medium, and rabbit agar, blood agar, that is a Skinner Drosophila medium. And serological test includes immunoassay, immunoblot, and indirect fluorescent antibody test, like we carried out in any of the viral disease and all that, antibody test, specific antibody. But the gold standard is a bone marrow biopsy or liver biopsy to find out whether there is a amastogates present or not, that is brown Hobbs staining. Treatment, there are very few standard treatment guidelines for leishmaniasis. First include the antimony compound, pentavalent one, the sodium stibogluconate. The dose is 20 mg per kg up to 850 mg per day, and either by IM or IV route. and it can go up to 20 to 30 days or more if need arise. And the second is a meglobin antimonate. These are all two antimony compound. Second one is a pentamidine, the diamidine, aromatic diamidine. This is a 4 mg per kg in alternate days, either deep IM or slow IV. The duration till no parasite seen in a splenic aspirate. You keep on giving this medicine on alternate days up to 80 days, and on routine basis you have to do a splenic aspirate and see whether there is no parasite or investigator present. Once they are present, means you have to continue the treatment, and since it is continued for longer period, the side effects are there. Allyl phosphocholine analog, Miltefosine, this is the oral one, 100 mg per kg daily, oral for 28 days, and others include Amphotericin B, this is the antifungal antibiotic, 3 to 4 mg per kg per day on day 1 to 5, 14 and 21, and this to be given in a IV infusion in a daycare center. Another antifungal agent is a Ketoconazole, mainly used for the dermal type of Leishmaniasis, 600 mg per day continuously for 28 days or till the patches clear. There are specific for visceral Leishmaniasis apart from the Ketoconazole, the Allopurinol, this is the hypertension analog. Originally it is a drug used in the treatment of gout, but it is also used in a visceral one. The dose is 4 to 12 mg per kg TDS, the duration is 28 days. Napacrine is a chloroquine derivative antimalarial one for 100 mg in 1 ml, and it to be injected at the site of the into the sore at body surface. Another is a Paromomycin and SITAMAQUINE, the antibiotic and antimalarial analogs, chloroquine analog. The main drug is a sodium Stibogluconate. It is a drug of choice for the VL, visceral Leishmaniasis. Water soluble pentavalent antimony compound, contain 1/3 antimony by weight. High resistance and treatment failure rate is 40%. It is rapidly absorbed from the site of injection, excreted and changed in urine within 12 hours, and a small fraction get deposited in tissue. The repeated doses are cumulative, so you have to cautious about the dose calculation. Mechanism, probably inhibition of SH dependent enzyme and shown to inhibit glycolytic and fatty acid oxidation pathway, and may interfere with the bioenergetics of the parasite that investigates. Adverse reactions are more common, which include nausea, vomiting and metallic states. This, since it is a metallic antimony compound, so metallic taste is there. Cough and abdominal pain is there. Pain and stiffness of injected muscle. Sterile abscess, pancreatitis, liver and kidney damage, myelosuppression, ECG change and shock. So you have to check all the liver and kidney enzyme level and ECG change while giving this one. Pentamidine is 70% bound to protein, quickly transported, taken up by the liver and kidney, stored for month together, and excreted and changed in the urine. Mechanism is most probably interact with the kinetoplast DNA and interfere with the topoisomerase second function, and probably interfere with the aerobic glycolysis. Adverse reaction is most common and seen in 50% of the patient, that include rigor, fever, nausea, vomiting, and IM intramuscular administration associated with the tissue necrosis, and IV administration associated with hypertension, palpitation, cardiovascular collapse. And so it is to be advised that patient kept supine for 1 hour post administration, and that's why it is to be given in a daycare center in any of the hospital or primary health center. And it is also reported that it has caused insulin dependent diabetes mellitus. Other use of pentamidine is a cotrimoxazole resistant pneumocystis pneumonia in an AIDS patient, and trypanosomiasis before the disease goes into a central compartment, that is before CNS involvement. Amphotericin B is an antifungal antibiotic, very highly effective, 100% cure rates, and mechanism is same as fungal action, that is formation of complex with the membrane ergosterol and the formation of a leak channel. And there are new compound, that is liposomal preparation of amphotericin B, but is too costly. Deliver the drug directly into the reticuloendothelial cell in a spleen. Adverse reaction is nausea, vomiting, fever, chills, anemia, hypertension, thrombophlebitis, and nephrotoxicity. Miltefosine, originally it was developed as an anti-cancer agent, but later on it was approved in India for the visceral type of Leishmaniasis in a oral formulation and having a high cure rate up to 98%. It is a protein kinase C, inhibition of CTP, phosphatidylcholine biosynthesis, and probably sphingomyelin synthesis inhibitor. ADR is a nausea, vomiting, elevation of a wetting transaminase, serum creatinine, and should be contraindicated in a pregnant woman. So once you start, you have to be routinely monitor the enzyme level, especially LFT and KFT, and more particularly a serum creatinine. Ketoconazole, another antifungal agent, it inhibits the enzyme lanosterol 14-demethylase, and which ultimately impaired the ergosterol biosynthesis and then altered the membrane function of organism. And it is highly effective in a dermal type of Leishmaniasis. Another agent is Allopurinol, designed for the uricosuric agent. It is a hypoxanthine analog. It converts the nucleotide by enzyme of parasite purine salvage pathway, and then incorporation of these nucleotide into RNA and interfere with the protein synthesis. Treatment failure rate is very high, so it is not a drug of choice for this, and can be used only as an adjuvant with other drug in resistance cases. It is a selective toxic effect on amesogate. Leishmaniasis metabolize allopurinol into corresponding nucleotide which are incorporated in RNA and interfere with the protein synthesis. May also compete with the ATP, and tried in Kala-Azar in India and Africa at a dose of 4 to 12 mg per kg TDS for 3 weeks. And it is again an add-on drug to the antimonial Stibogluconate main drug. This is another drug, Paromomycin. This is the aminoglycoside antibiotic like streptomycin, widely tried in India and Africa for Kala-Azar by intramuscular injection, and found to be effective in sodium stibogluconate resistance cases. In a recent phase 3 trial in Bihar, Paromomycin 11 mg per kg per day for 21 days has yielded around 95% cure rate, but it produced ototoxicity and elevated all serum transaminase level, and may prove to be a effective and easier to use alternative to amphotericin B in resistant cases of Kala-Azar, and it has been recently approved for the drug used in Kala-Azar. This is another drug, SITAMAQUINE, new drug. It is a 8-aminochlorine derivative, only drug that was developed for the treatment of visceral Leishmaniasis. Only advantage is it can be administered orally. The phase 2 trial demonstrated its efficacy and very well tolerated. The side effects like vomiting, dyspepsia, cyanosis, nephrotic syndrome, and glomerulonephritis were also observed. Further outpatient care, they perform a follow-up evaluation of patient 6 weeks after last dose. Topical drug for dermal Leishmaniasis, is a sodium stibogluconate, that is infiltrate 2 ml of the solution 100 milligram antimonial ml round the sore of the structure, and the Paromomycin ointment applied topically on the sore, and other antibiotic for secondary infection of the sore. The recommended treatment regimen for visceral leishmaniasis in India: one is conventional Amphotericin B, another is a liposomal Amphotericin B, Miltefosine, Paromomycin, and sodium Stibogluconate. So there are three combinations which were approved: liposomal Amphotericin B plus Miltefosine for 7 days, liposomal Amphotericin B plus Paromomycin for 10 days, and Miltefosine plus Paromomycin for 10 days. In case of HIV visceral leishmaniasis co-infected patient, there are guidelines which include liposomal Amphotericin B 2 to 4 mg per kg IV daily for 10 days, or interrupted schedule like 4 mg per kg on the day 1 to 5, on 10th day, on 17th day, 24th day, 31 days and 38 days to achieve total dose of 20 to 60 mg per kg. Another is Amphotericin B desoxycholate 0.5 to 1 mg per kg IV 4 times for total dose of 1.5 to 2 grams, or sodium Stibogluconate 20 mg per kg IV or intramuscular daily for 28 days, and ART should be initiated or optimized. Alternate regimen for treatment failure with this is a Miltefosine 2.5 mg per kg per day per oral for 28 days. So you can summarize that sodium Stibogluconate use drug for all forms of disease. The alternative agents for visceral leishmaniasis are Miltefosine, Pentamidine and SITAMAQUINE. For mucocutaneous disease, Amphotericin B, and for complicated and emergency cases, Amphotericin B. This is all small chapter. I don't know how can you interact and ask question if it is there. Thank you very much. So all these are present.
पर ये करने भी तो बहुत सारे लेकिन ये ऐसे ठीक करने में यार सीरियसली बट नहीं पूरा है, इसको बंद करके बताओ जरा। इतना तो वैसा भी नहीं आता।
हो गया ना?
हाँ हाँ